in the early 60s, it was discovered that Ibogaine and Iboga had a significant interruption effect on opioid addiction. There was an individual who had been addicted to heroin for a number of years. They took Ibogaine, and not only did they not experience any withdrawal when they stopped taking heroin, they stopped having any desire to use any drug whatsoever. This touched off 60 years of open-label field studies that are mountains high and decades wide that firmly establish that Ibogaine has a unique and singular interruption capacity on physiological substance dependency, whether that's opioids, alcohol, methamphetamine, cocaine, or tobacco. Recent evidence also suggests that it has a significant interruption effect on compulsive behaviors, anything that kind of impacts that brain's dopamine system and produces a rush.
Particularly gambling.
Special forces, special operators started going to Mexico for treatment of symptoms of traumatic brain injury, expressed through treatment-resistant depression, anxiety, and suicidality. Many of these veterans had gone through the VA system. They had been given an unbelievable amount of synthetic pharmacology that, in their end effect, essentially anesthetizes the soul and slowly euthanizes the body. And they were at the end. So as they were going to Mexico and would get Ibogaine treatment, they came back with these just unbelievably just powerful recovery results that seemed too good to be true. So there were some scientists at Stanford University that were funded by philanthropists who wanted to understand what was going on. And so what we have come to learn through a Stanford research study on traumatic brain injury for vets is that Ibogaine has remarkable neuro-regenerative capacities on the brain that are unheard of in the annals of Western science. And while information is still very small in amount and preliminary, there are individuals who have had Ibogaine treatment for not just traumatic brain injury, but for multiple sclerosis, Lyme disease, Parkinson's disease, post-surgical complications related to the removal of brain tumor who endorse a restoration of functionality and an ability to live that are otherworldly. And as we recognize that the opportunities to improve the human condition at scale are multi-lifetime in appearing, we believe that we have found one of those.